Thank you for joining us, Dr. Eneyni. One of our viewers, Sean, has a question would like to know, what is Botox?
Well, Botox injections are injections that we perform on patients to paralyze certain sections of their muscles. Botulinum is actually a bacteria that blocks the conduction between the nerve and the muscle, so it paralyzes the muscle in those certain spots that we inject it in.
Does it hurt?
It will feel, in the locations that we inject for migraine, it will feel like a mosquito bite. There will be a few of them, but it's usually generally not a painful procedure, and generally we do not give any local anesthetic with it. And it should be a straightforward kind of procedure.
Does insurance pay for this?
Most insurances do. It was approved in late 2010 for migraine prevention. It is used also for many other reasons, but we have to go through procedures here to get it approved by the insurance company before the injection is done and before you even get an appointment for this. So the process of things goes that you have to talk to your doctor about it, and if he or she feels that you're a candidate for it, then the approval process can start and then you can receive the injection.
Okay. And when can you see improvements after getting the injections?
Well, that's a very good point. When you get the injection, you will not see any improvement for about 3 days. And then you'll start noticing that the muscles that we injected it in, which will be in the forehead and the scalp region, starting to become slightly weaker, so you can't wrinkle your forehead or make funny faces at people. And in about so that starts about 3 days and should last you for about 3 months or so. Now there's some give or take, so it could be a little less, a little more, but generally it's around that time frame.
Okay. And how long is it until you get your next injection set, or do you get multiple injections?
You'll get multiple injections that visit, and then we generally ask you to come back in about 3 months to have more. This will wear off in about 3 months. So every 3 months you're going to have that injection done again.
Okay.
And potential side effects of this, which is one of the questions that we get asked by Sean on Facebook, was what are the potential side effects of this procedure? And the Botox works by paralyzing the muscles that we injected in. So obviously one of the side effects is that there will be too much paralysis. When we use it for migraine, we are injecting the forehead and the scalp region and a little bit of the neck region. So generally these muscles, if they are a little weaker, it's not a terrible kind of side effect, but one could potentially see a droopy eyelid or some weakness of the forehead muscles. But that's rare, and generally patients who get it for migraine don't tend to experience a lot of side effects. There's always a risk of infection every time you puncture the skin, but of course we use sterile procedures and sterile equipment when we do this. There is a risk of spread of the Botox from the geographical location that we injected in into other parts of the body, and that is extremely rare, and it is thought that actually the person who did the injection did it near a vessel and the blood actually transferred that medication to other locations and made it paralyzed. But generally the paralysis is very localized to the spot where we inject. Pain during the procedure is minor, as you asked that question earlier. It was very minor, so that should not be an issue. And other than that, it is cost, but most insurances now pay for it. Other than that, it's a very effective medication for treatment of migraine. It is nowadays approved by insurance companies for patients who have about 15 headaches or more per month, and they have to last a few hours, and they have to have failed certain preventive medications. I think you and I did another interview relating to preventive medicines for migraine. So they have to have failed some preventive medicines in the past for them to be allowed to receive Botox injections. The injection itself is not expensive. It is the material, the medicine itself that is extremely expensive. It has to be handled in a certain way when it arrives to the office, so it kind of causes a little bit of expense there. But other than that, it's a paid-for procedure.
Okay. Thank you for joining us.
You're welcome. Anytime. We'll see you soon, I guess, on our Facebook channel and YouTube channel. Is it Facebook /Angels Neuro, and YouTube channel also Angels Neuro.